Okay, everyone. Looks like everyone's joined us, so we'll make a start. I'd like to start with the acknowledgement of country. And in the spirit of reconciliation, SHPA acknowledges the traditional custodians of country throughout Australia and their connections to land, sea and community. We pay respect to their elders past, present and emerging. Hello everyone, I'll introduce myself before we get started. I'm Tom Simpson, I'm facilitator for today's launch, and I've served as an advisory committee member for the forecast last year as well as this year. I'm vice chair of the TAS branch committee of SHPA and a member of the SHPA Leadership and Management Leadership Committee, and in my day job, I'm head of hospital pharmacy in Tasmania. So thank you all for joining us today for the launch of Pharmacy Forecast Australia 2022. This is the forecast's second year, and we're very excited to be back and to have you all join us today for the overview of the new edition. To me, Pharmacy Forecast is a very important piece of work. It doesn't just inform the society and its pharmacist members, but it informs the entire health sector, including clinical stakeholder groups, training providers, regulators, and funders. And it succinctly captures the challenges and transformations that will be shaping medication management in Australia over the next 5 years. And the forecast includes recommendations, many of which are a call to arms to SHPA members and the health system more generally, to actively drive change towards positive goals rather than passively await the future. We were thrilled with the response to the inaugural Pharmacy Forecast Australia in 2021, and this year we've pushed ourselves further through the development process and the analysis, and that's culminated in a 2022 report, which we believe will provoke and shape more robust strategic conversations. Today, we'll be hearing 5-minute snapshots from each of our 6 theme representatives of our advisory committee, including committee chair Russell Levy, before opening to questions. As we go, over the next hour or so, we'll be noting questions through the chat box, and we'll address them then during the Q&A time later on in the session. So please do jump into the chat box as we progress through today's presentations, put your questions in, and we'll answer as many of them as we can during the Q&A session at the end. Finally, at the end of our session, to finish off, we'll hear from SHPA President Peter Fowler and Chief Executive Kristen Michaels. Firstly, I'd like to extend a very warm welcome to the Honourable Michael McCulloch, former Deputy Prime Minister of Australia, and representatives from the offices of New South Wales Minister for Regional Health, Bronnie Taylor, and Dr Anne Webster, Federal Member for Mallee and Shadow Assistant Minister for Regional Development. I would also like to extend a warm welcome to David Dutka, Commercial Director for Australia and New Zealand of Omnicell on behalf of our supporting partner organisation, Omnicell. And I'd like to invite David now to say a few words about the partnership.
Thank you very much, Tom, and a big thank you to the Pharmacy Forecast Australia team for our esteemed partnership and the continued support. We very much look forward to working together into the future. For those I'm yet to meet, I'm David Dutka, Commercial Director at Omnicell Australia. Next slide, thanks, Laura. As Omnicell celebrates our 30th anniversary this year, our mission has always remained the same: to be the clinician's most trusted partner for medication management. 30 years ago, Omnicell was founded by our current CEO, Randy Lips. When Randy's daughter was hospitalised at birth, he observed how inefficiently medical supplies were managed. He saw that this prevented nurses from spending more time directly caring for patients. Randy founded Omnicell in 1992 on the premise that better management of medications and supplies would improve a hospital standard of care. This inspiration is reflected in our dedication to continuously deliver innovative technology that actually helps our customers improve patient care for everybody. Now, as we move forward 30 years, our vision is to deliver the most compelling automation solutions that accelerate pharmacy perfection. Next slide, please, Laura. As we continue to navigate a COVID world, we're seeing that burnout is playing an increasing role in emotional exhaustion and depersonalization, with the biggest contributing factors being medicine supply issues and increased workloads. Furthermore, we're seeing turnover rate for nursing almost twice the rate of the national average. And of course, burnout and turnover rates don't help with medication errors. An Australian study found that around 9% of medication administrations were associated with a clinical error, and this is excluding timing errors. And an estimated 230,000 medication-related hospital admissions occurring each year. And all of this comes at a cost. The research suggests that an annual cost of medication-related admissions to be around $1.2 billion. Next slide, please, Laura. Imagine if pharmacists and nurses were able to spend 100% of their time on patient-focused care. No more sorting, picking, checking, reconciling, or any other error-prone manual task or workflows. Now imagine errors, inventory management, diversion, and non-compliance as distant memories. This is the vision of the autonomous pharmacy, a zero-error, fully automated digital medication and supply management infrastructure designed to address the clinical, operational, compliance, and healthcare challenges. A fully autonomous pharmacy helps to safely and securely deliver the right dose to the right patient at the right time, anywhere across the healthcare network. The autonomous pharmacy is a bold new vision for medication management that seeks to replace manual, error-prone activities with automated processes that are safer and more efficient. The ultimate goal is to reallocate talent to higher value tasks that improve patient outcomes. As we continue the journey to support pharmacy transformation, the solutions we deliver to customers are centered around core beliefs that reflect our brand and our values. Thanks, Laura. Next slide, please. We are grateful to partner with SHPA for the Pharmacy Forecast Australia, which gives hospital pharmacy the tools to help address today's challenges and drive change for tomorrow. If you are interested in learning more about how we can help you automate your pharmacy, come speak to us and our Australian business partner, Meditech, who we have been delighted to have as our trusted partner for 13 years. We have a customer experience centre based in Melbourne, aimed at providing education sessions on our automated solutions. You'll learn about technologies and have the opportunity to witness live demonstrations that will help your hospital improve medication workflow, create staff efficiencies, and understand the benchmark in best practice medication management. A big thank you again to the Pharmacy Forecast Australia team, SHPA, Meditech, and everyone in attendance today. I'll now hand back to you. Thanks, Laura and Tom.
Thank you, David. It is now my pleasure to introduce our fearless leader and someone whom I regard as one of the great gentlemen of Australian hospital pharmacy, Chair of the Pharmacy Forecast Advisory Committee, Russell Levy, to get us underway today. Thanks, Russell.
Thanks very much, Tom. It's very kind of you. So Pharmacy Forecast Australia grew from the relationship between SHPA and the American Society of Health Systems Pharmacists, whose pharmacy forecast has grown over the past decades to become a key feature of the Society's educational landscape. And we welcome our international friends joining us here today for the launch of our second Australian edition. The Advisory Committee began developing the survey by engaging in a series of workshops to identify and interrogate key issues believed to influence health system pharmacy in the coming 5 years. And this year in particular, we challenged ourselves to thinking outside of the normal comfort zones. The list of issues was expanded and refined through an iterative process, resulting in the final set of 6 themes, each with 7 focus questions on which the survey was built to help explore those themes. So after another disruptive year in healthcare, it's not surprising to see new themes arise in mental health and workplace well-being, hospital and health funding models, and environmental sustainability, which captured the zeitgeist amid Australia's move towards living with COVID-19. Our theme leads who were responsible for the actual analysis of the survey results were chosen from across the nation and having broad experience and skills in their particular area of expertise. So we thank them for that. For the survey, we received responses from 96 forecast panelists, which is a return rate of nearly 80%, which is fantastic. And our forecast panelists were all directors or in senior leadership positions, and a majority reported their primary practice settings or organizations offered a diverse range of services, including home health or infusion care, specialty pharmacy, inpatient care, ambulatory care, and pediatric care. And finally, as an added layer of depth to the content of each theme, we again invited a selection of key organizations with specific expertise and knowledge relative to each theme to provide a piece of commentary for inclusion in the report as a partner perspective. I'd particularly like to thank the members of the editorial subcommittee, who were also part of the advisory committee, Jeannie Misko and Paul Toner. They did an amazing job reviewing the entire document and editing it for us, which, as you can imagine, is a big task when you have so many authors and leads involved. So thanks again, Jeannie and Paul, for that. And I'll hand back to you now, Tom.
Thank you very much, Russell. Now, Russell was responsible for our second theme today, so we'll be hearing from him again shortly, as we'll now be moving through our Pharmacy Forecast Advisory Committee presentations. So Russell and I have been on the committee, and also joining us today to talk through their sections and recommendations are Jeannie Misko, Ange Young, James Grant, and Andrew McLaughlin. Shortly we'll go through those themes and sections. I guess I'd just like to talk through personally the rewarding experience that it's been to be put in a position where we can really consider what are the things that will be strategically important over the next few years, and then to seek the wisdom of SHPA members and other bodies and really bring that into the process. But also the lovely teamwork that's taken place within each of our themes, very much partnerships of equals amongst all of the themes that we've worked in. And I think we've all been very proud of the work that we've been able to hand over to SHPA. So with that said, I'd like now to hand over to theme one and introduce Jeannie Misko to talk about the environmental sustainability theme.
Thank you very much, Tom. So our first theme for Pharmacy Forecast 2022 is environmental sustainability. I'd like to acknowledge Hal Votran, who has been our fantastic lead for this theme, and Grace Wong and Debbie Rigby, who are our theme leads. Climate change is the greatest global threat this century, but it is an opportunity to take responsibility to minimise the environmental impact of medicines within pharmacy. There are a range of actions that pharmacy can take to benefit not only the environment, but our patients and the wider community. Next slide, please, Laura. The forecast survey instructed participants to read each of the questions presented and consider the likelihood of these scenarios occurring in the next 5 years. They were asked to base their responses on their first-hand knowledge of current conditions in their region and provide a top-of-mind response regarding the likelihood of those conditions being very likely, somewhat unlikely, or very unlikely to occur. What we have showing on the slide here is the first of 3 of 7 questions and results charts for the environmental sustainability theme. These initial questions were looking at information guidance on the environmental impact, education on carbon literacy, and environmental sustainability, and paper-free pharmacy departments. As you can see, many of our panelists felt that it was unlikely that these would occur in the next 5 years in all departments. And next slide, please, Laura. So the remaining questions focused on environmental impact criteria in medicines tenders, champions for environmental sustainability within pharmacy departments, pharmaceutical waste programs across the spectrum of medicines use, and use of inventory and technology solutions to reduce wastage. Here, panelists mainly felt that there would be positive changes within the next 5 years, but that technology changes were less likely. And next slide, please, Laura. The recommendations from the environmental sustainability theme are listed on the slide here. First, it is recommended that all hospital medical record systems include information on environmental impact on medicines. This will allow clinicians to make an informed decision with the information present at the time of decision making, similar to any other clinical decision support tool. Then, all pharmacy degree programs should include environmental sustainability principles within the curriculum. This will impact positively on the workforce, as when those students then enter the workforce, they can educate their colleagues and become leaders in ensuring sustainability in the manufacture, supply, and prescribing of medicines. Paper-free pharmacy departments is an aim many of us have been trying to achieve for some time. Technology is catching up to where we want it to be, and there are now more options available to reduce paper usage and eventually eliminate it. Becoming paper-free also requires collaboration with other parts of the healthcare organisation, as well as outside partners, such as GPs and community pharmacies, and also the use of closed-loop medication management. Pharmaceutical contracts, they're a very powerful opportunity to consider and influence positive sustainability of medications. By assessing completing suppliers against environmental impact criteria that are both accountable and meaningful, the industry can influence positive sustainability in both the pharmaceutical manufacturing and supply process. Environmental sustainability champions within the pharmacy department are recommended to lead, champion, and then maintain environmental change for the better, allowing these passionate individuals time, money, and support for the process can lead to positive changes for sustainability within the pharmacy department and change attitudes and practices. All pharmacy departments already have a pharmaceutical waste program in place, but extending the waste program to include not only medicines, but packaging and the associated tools used to administer and deliver medication can assist in further reducing waste and improving sustainability. This may involve better utilisation of our current waste programs, new additions, and also education. And finally, technology available within pharmacy departments can also be utilised to determine how inventory wastage can be minimised. For example, this may be as simple as rotating stock close to expiry to high usage areas. Analyses can also be undertaken in how to improve the readability and usage of wastage data and consideration of technology that would improve this process in the future. That's it for theme 1. I would now like to pass on to Russell for our second theme.
Thanks, Jeannie. So theme number 2, future workforce. So thanks to our additional forecast advisory committee member, Jeannie Misko, for your assistance with editing this theme. And I'd especially like to thank our theme lead authors, Tim Garrett and Sven Marks, and they did a fantastic job in analysing the results of the survey. So future workforce theme is one that's not surprisingly deserving of attention in this year's forecast, given the multiple changes we've seen in healthcare demands over the past couple of years in particular. The pressure points for pharmacy are to continue to upskill and the emerging workforce and to meet new and growing demands as well. And careful workforce planning with strong leadership is needed to form a vision in collaboration with professional, industrial and healthcare partners for that to happen. So this theme, future workforce, explores a number of those topics and provides some interesting thought-provoking analysis on how we might get there by 2027. So next slide, please, Laura. Okay, so as Jeannie showed, these are the questions first three of the 7 questions that were developed for future workforce. So the first question, forecast panelists were a bit skeptical in their response to at least 50% of key specialised hospital pharmacy positions will require specialist practice certification recognised by a peak authority. The second question, the majority of forecast panelists doubted that the visibility of the roles in the pharmacy workforce and clinical benefits provided will result in jurisdiction-wide pharmacy workforce strategies with legislated clinical pharmacy staffing ratios in accordance with SHPA standards of practice. So we know across the country there's significant variation in staffing levels and resources. And practice standards, unfortunately, for pharmacy don't always determine the staffing ratios. So thoughts are given towards a national pharmacy workforce strategy being developed to help address this. The question 3, forecast panelists expressed optimism, I think, that at least 10% of university undergraduate pharmacy courses will be developing programs to deliver intern registration requirements through practice-based placements to deliver registered pharmacists ready for immediate appointment at completion of their course. So graduates need to be workforce ready. About 82% of undergraduates at the moment, when you ask them, express an interest in a career in hospital pharmacy, but then it's limited for the hospital intern positions that are actually available, meaning that most graduates will, like it or not, end up going to the community for their internship at least. So will we see a change in that in the next 5 years? That's something that the forecast sought to get the opinions of the panelists about. Will there be an emergence of courses that combine the internship as part of the undergraduate course curriculum so that candidates are job ready for hospital pharmacy at the time of graduation? Next slide, please, Laura. So the remaining 4 questions are displayed here. Question number 4, the forecast panelists strongly agreed with this one, that at least 50% of hospital pharmacy technician workforce will be able to access credentials training programs supported by their hospital or subsidised by the federal and or state governments to gain competency practice roles as identified by SHPA's white paper from a few years back. So will we see a pharmacy technician residency program in the coming years to address the gaps in our current certification processes, perhaps? So there's a bit of optimism there from the forecast panelists, which is good to see. Question 5, the forecast panelists were split pretty much about the experiences that the COVID-19 pandemic has given that will have led to a 50% increase in hospital pharmacists employed in non-traditional roles, such as clinical and governance, risk management, informatics, and senior or executive operational roles. And this could be because people already think that we're doing that, being involved in non-traditional roles. However, the explosion in IT-related positions and heightened profile of hospital pharmacists from the COVID vaccine rollout should really be a platform to demonstrate what else pharmacy can do and how we're capable and versatile in those different areas from what people traditionally would think. So having a platform to raise awareness and publicize those things would be something that would be great. Question 6, the panelists were split on this question as well. So pharmacy professional leadership will be representative of the gender and cultural diversity of Australia and be supported by quotas. So this should be a priority, really. And I think although the forecast panelists were split in their response to quotas, active steps will probably need to be taken to make a change in that diversity in the leadership level, because we know there's multiple benefits in having a diverse representation in leadership positions. And finally, question 7, the forecast panelists were strongly in agreement with this one, that technology deployment generating clinically relevant data will allow workplace flexibility by enabling improved clinical decision-making information and informing medicine use and selection, especially in critical care environments. So we are going to be continuing to ride the electronic wave. Most people are feeling optimistic about that. We need to keep on making sure that those developments with electronic solutions and whatnot are going to be having a patient-centered approach to them, and in order to change the way we work in a positive way to deliver better services based on the ability to have good information, and probably more about that to come in other themes. So next slide, please, Laura. So there's 7 recommendations that were made for future workforce theme to help address the issues. And of particular note, I'll mention a few here. So firstly, overcoming the barriers to pharmacist specialization and unified pharmacy technician credentialing is a recommendation. Describing the pharmacy workforce to inform a national pharmacy strategy is an important one. Building momentum for new graduates to be practice ready. And of course, advancing technician roles in the profession, and well underway with that, but that needs to continue on as well. The next recommendation, setting an example for versatility across the profession, relates to those diverse roles that we may be undertaking now compared to previously, and diversifying pharmacy leadership demographics in a proactive way, such as considering terms of references and to include for diversity and gender balance, making sure that we're aware of unconscious bias when we're recruiting, and also perhaps enshrining some sort of diversity education amongst leadership positions as a way to tackle that unconscious bias that's there. And the last recommendation, capture the benefits of big data for frontline clinicians. So that's pretty much it for future workforce theme number 2. I'll hand over to Ange Young to talk about number 3.
Thanks, Russell. I'd like to acknowledge our 2 theme leads and authors, Deirdre Criddle from Western Australia and Brett Chambers from New South Wales, as well as my co-pilot, James Grant, who's our second advisory committee lead for this theme. We were so excited about this theme as it gave us an opportunity to really explore the typical patient and consider who, as pharmacists, our sector is here to serve. Apart from the person with an acute illness in hospital or the person in the community with a chronic illness, we wanted to make sure we included those who were previously forgotten or fell into the gaps, such as those in aged care facilities, those moving between services, those isolating at home or unwilling or unable to travel, as well as culturally, linguistically diverse people. Most of the questions for this section were born from innovations trialled or implemented around Australia and the globe. many of which were catapulted into practice during COVID-19 pandemic, all with the intention of increasing accessibility to clinical pharmacists, reducing harm and maximising outcomes for all patients. So let's move on to our survey results. In question 1, nearly 2/3 of respondents were positive that by 27, improved availability of accurate patient information would enable our pharmacy services to allocate a significant proportion of their time towards patient-centred value-adding clinical services or activities. That is, we should be seeing greater efficiencies from IT systems that make medication histories and reconciliations much quicker than they currently are for many services. We were a bit surprised this wasn't higher, given the increased use of My Health Record and electronic medication records, and wondered if it's highlighting that further interoperabilities and refinements are still required to truly realise the efficiencies of these systems. In question 2, about 3/4 of respondents thought new models of care would be adopted in the next 5 years. So exciting for pharmacy, which includes things like telehealth, hospital in the home, post-discharge services. This was also mirrored in question 6, which is on the next slide, where about 3/4 of respondents thought at least 75% of hospitals in their area would have staff dedicated to transitions of care and liaison with GPs and community pharmacists. We love seeing this because it shows that pharmacists are really looking to provide care to patients where they need it, at home or in aged care facilities, potentially preventing a hospital presentation or a readmission, and reflects the successes that many areas have had in this around Australia. And there are some great examples coming out of almost every state with different programs that have been trialled and implemented. Question 3, despite the target of 10% of hospitals offering precision medicine, which we thought was quite low, precision medicine particularly includes pharmacogenomics, only just over half of pharmacists believed it would be offered in their area. This was surprisingly low for us, given that its uptake in the EU and the USA, and its inclusion in a number of funded Australian grants and research programs. There may be contextual reasons for this, including our geographical spread in Australia and other barriers, including lack of personnel, IT, infrastructure, and awareness. Next slide. In question 4, just over half of respondents do not think there would be dedicated resourcing for a deprescribing stewardship pharmacist in their area in the next 5 years. We'll get a little bit more onto that later. And in question 5, only 58% of respondents believed all patients would receive a medication list and plan on discharge that was suitable for their culture, language, and level of health literacy, including 16% that thought it was very unlikely. This was surprising for us, given it's already a requirement from a hospital accreditation perspective, and I think identifies there are some gaps that urgently need addressing. In question 6, I covered that earlier with question 2. And in question 7, over half respondents believed automated dispensing cabinets would be utilised, especially in high-risk settings. Despite ADCs being part of the closed-loop medication management lifecycle, the remaining respondents are probably still identifying that there are barriers for the implementation, including the need for complete implementation with other electronic medication systems, as well as the need for workforce and workflow changes and limited funding opportunities. Next slide. There were a number of recommendations for patient-centred care, and I'll highlight just a few of them. On the first row here, we see publish and promote to help spread innovation. Pharmacy leaders and clinicians involved in new specialty areas and models of care, and particularly the ones that we were looking at in terms of transitions of care and outreach programs, must partner with health researchers and academics to perform robust evaluations and publish results. We've seen some great publications that I'm sure there are other pockets of success that may not be as widely known about. Professional bodies like SHPA can facilitate collation and dissemination of models and their supporting evidence. Having information like this really does help other services around Australia build cases for funding, as well as opportunities for them to broaden their services. Next slide. Taking a professional lead on pharmacogenomics and starting to build a pharmacogenomics journey. I think the time is now. We want to make sure we don't miss this boat. Pharmacy leaders, professional bodies and universities should be helping to lead awareness and growth of pharmacogenomics through education and training, competency and guidance for pharmacists, and research collaborations. And pharmacy departments should be actively implementing pharmacogenomics into their services and models of care wherever possible. The American Society of Health System Pharmacists recently published a position statement advocating for pharmacists to take the lead role in pharmacogenomics to improve clinical outcomes and patient safety. This would be a great resource to start with. And finally, amplify advocacy on deprescribing pharmacists. I think stewardship pharmacist roles, such as antimicrobial and analgesia, have traditionally taken a while to become embedded into practice. And we think deprescribing will be no different. Similarly to other roles, it will depend on the hospital setting as to whether sites are able to dedicate a sole pharmacist to this important role or resource and equip existing pharmacists. Needless to say, the pharmacy profession should continue to advocate for specific skills in and focus on deprescribing that is appropriate for both specialist and generalist pharmacists. These pharmacists can play an important role in providing timely comprehensive medicines review, informed by shared decision-making with multidisciplinary teams, the patient, carers, and family members, and focused on agreed goals of care. So thanks for your time. I'd like to now introduce James Grant for Theme 4 Technology.
Thanks very much, Ange. Hi, everyone. First and foremost, I'd like to acknowledge Peter Smart in Western Australia, who was the other committee member on this theme with me, and who unfortunately couldn't be here today, as well as our fantastic theme leads, Aaron Van Garderen from Queensland and Jared Yip from Victoria. So it was wonderful to work with a group of people from all around the country, nearly as far north, south, east, and west as we could go, with each area approaching technology and healthcare slightly differently. So it was a wonderful working group. So unsurprisingly, technology cropped up again this year as a bit of a key theme when looking around what's coming in pharmacy's future. And obviously there was a bit of a on the ground talk that with COVID, hospital systems that were equipped with more digital health functionality found it a little bit easier to cope with the pandemic, whether that's providing telehealth or remote monitoring and things like that, or simply being able to gather data on how things like medication supply levels were going, as well as the status of their patients under their care. And obviously, as we've seen in the first 3 themes so far, technology is coming through as a strong enabler or tool in how we do a lot of different things in pharmacy practice. So let's see what specific questions we asked and what the results were. Next slide, please, Laura. So we went in strong with a bit of an aspirational goal, seeing whether or not 3D printing of pharmaceuticals would be a tool in the kit for shoring up supply shortages in the nearish future. And we got a resounding no to that, which was very enlightening to see. And under recommendations, I'll delve into more into what we do with that information. It was really good to see a definite response, even if it is in the negative, but it gave us a lot to work with. Question 2 was talking about the practicality of cybersecurity and data breaches and whether or not that was likely. And again, a really strong response that yes, it is. It's going to be at least 5% of hospitals will undergo a cybersecurity data breach. And yet, unsurprisingly, that healthcare sector is a big target for this sort of activity. And it's good that we can look ahead to planning and how we make things as secure as possible for our patients and ourselves. Question 3 was looking at whether or not technology-assisted delivery services would be able to improve access to medication, foundation to the quality use of medicines principles. And that was, again, leaning towards the negative, but somewhat likely about a third of respondents thought it was more on the positive side. And this was a great example where perhaps the question wasn't phrased as broadly with as many examples as the group had initially planned in how we can actually use technology to improve access to medications as a core tenet of the profession. And we'll touch on a couple of recommendations and thoughts on that on this last slide for me. Next slide, please, Laura, for the last 4 questions. Internet of Things, and asking our fantastic panelists whether 50% of hospitals would offer a virtual healthcare service that used Internet of Things devices. And again, pretty positive, 2/3 of respondents thought that yes, we would be over the next 5 years. And things like, Apple Watches, Google Watches, and things like that are quite prevalent. And they'll just be more so in the years to come. And how are we going to use that to practice better medications management and healthcare provision? Question 5 looked at whether or not over half of the hospitals in the countries would be uploading codified medication data into the My Health record, where we're mapped to an Australian Medicines Terminology identifier. And again, very strong signal there that nearly 90% of respondents thought that we would be doing that. And that was fantastic to see that sort of level of technology uptake having a good spin on it, which it can be quite mundane and very ones and zero-y, but without it, we can't build a lot of the other benefits that we'd like. Question 6 focused on a similar question asked earlier in the survey about specialised health informatics pharmacists, and that 3/4 of hospitals would be looking to employ someone with some sort of postgraduate qualification in that area. And again, nearly 2/3 of respondents felt yes, they would be looking at having someone like that on their payroll to help do the work that technology requires in the healthcare sector and in pharmacy. And the last question was whether or not 100% of hospital patient records would be seamlessly linked electronically within the hospital or their health network, or up to the entire state and territory. And again, just over, that one was sort of split down the middle, 50-50 or 51-49. And as the group discussed that, we thought a lot of that was to do with already trying to integrate with the My Health record. Within your own hospital can be challenging, going to your state, going to your health service. It's a lot of different steps to consider, which is why we thought the split was there, even though we're getting such a good positive result on question 5 that codified medications data would be going up to the My Health record. Question 7 asked a much broader question, so it made sense that it was a bit more split. Next slide, please, Laura. So what were our recommendations? So obviously to utilise technology to improve patient access to medicines. And we covered off things like drone delivery in the actual question survey. And I think the recommendation we have ended up publishing in the report to come is that it doesn't need to be an Amazon drone picking up your medications and dropping it to you. It could be a rideshare service or something to that effect. That just means the patient can leave the hospital sooner, and you can get the medication to them afterwards, 1 or 2 hours after they get home, but they can leave the facility sooner. So there are different ways of utilizing technology that might not be quite, dare I say, Star Trek, but still helps get the job done of providing healthcare quickly, efficiently, and effectively. Recommendation 2 in the report looks at exploring technology to improve efficiencies and our safe and secure medicines delivery. I've obviously mentioned actually physically getting medications to the patients. This recommendation is using in hospital or in community provision of medications. And the fact that things like electronic health records, electronic medications management, once that's embedded into your workflows and available, and there are barriers to that too, then it allows you to do things, it does allow things to be done differently. Recommendation 3 was to focus on strengthening cybersecurity. And whilst there's a lot of technical work that can be done there with vendors, with anyone developing software really, from a pharmacy department or someone that's working with medicines management specialists, it can really boil down to make sure that you don't share your password. Make sure that people aren't looking over your shoulder when you're entering data in and out of the screen. It doesn't need to reach all the way to 100% right now. There are small things we can do to help improve cybersecurity. Recommendation 4 was about embracing virtual care delivery and new data devices. So things even like smart insulin pumps already generate a wealth of data, and hopefully those will become more accessible and available to healthcare practitioners throughout. That'll give us different ways to provide better care to our patients, as well as things like teleconsultations, telecounselling. How we do medications counselings in the future could look quite differently, and hopefully more appropriate for all of our patients. Recommendation 5 is working on improving a culture around codified data use. So those uploads to the My Health record work a lot better for everyone involved if we're using the appropriately coded data from the Australian Medicines Terminology or something like SNOMED, CTAU. And again, not trying to get people to become data entry monkeys, but the fact that if you pick selected medication classes or allergy classes that you really want to focus your department towards codifying, that improves what that medications data can do for both your peers as well as other health professionals and the patients themselves, both tertiary care, secondary, primary care. It's a sort of a small change and it's nitpicky, but we think it could have a great magnifying effect in the years to come. And lastly, to build a workforce upskilled in technology. And not only are the postgraduate certificates and things like that in IT, cybersecurity, biotech and things like that that could be encouraged. It can simply be, allowing the computer-friendly staff in your department to go a little bit further with a couple of ideas every now and again, and to encourage the uptake of technology in your local area. Thank you for listening, and I will now pass to Tom Simpson for theme 5.
Thank you very much, James. So I'd like to first of all acknowledge the others who contributed to this. Anna McClure, who was one of our other theme leads, who's Exec Director of SA Pharmacy, and Paul Toner, who really helped with this theme and took over when we had panel member fallout. Unfortunately, Paul being Director of Pharmacy at Royal Melbourne Hospital. So thanks to Paul and Anna. Believe it or not, I specifically asked to work on the funding models theme, much to the surprise of the others in the group, because I actually know this is the fun one. This is where the interesting action is at that drives all of the other themes. So on with the show. Next slide, please, Laura. Here are our first 3 questions. And the first one is around whether contemporary 5-year pharmaceutical reform agreements will be in place across Australia. And it's pleasing to see optimism here. Pharmaceutical reform fundamentally is around medication safety and medication equity. And I think the optimism here reflects the desire to see all Australians having access to the safety and equity benefits afforded by those reform agreements, including those in New South Wales and the ACT who currently miss out. And so I'd also say that there's optimism here to move to a contemporary agreement model. The current reform agreements, I think the oldest of them is the Victorian one, which is 22 years old. And so the idea of moving to something perhaps more similar to the community pharmacy agreements, which operate on a 5-year model, drives some of the optimism towards our first question. Our second question was on the availability of PBS funding for all Medicare eligible patients, irrespective of care location. And it's fair to say there's a significant amount less optimism for this in the future. And we felt this was concerning. It suggests a lack of alignment between medication access and the location of care. And we've seen growing roles for hospital in the home, where you have admitted care taking place in a patient's home, which begs the question, who pays for the medicines that a patient takes in the comfort of their own home while they're in a HIF program? We've also seen, as we saw strongly in theme 3, huge growth in telecare, community inreach and outreach models. And those models make it clear that the boundaries that used to exist between patients, their care providers and their physical location are no longer relevant to the delivery of care. Despite that, those factors are all key determinants of whether medicines will be funded by the Australian government. And so there's the risk that improvements in patient-centred care are stifled by the inflexibility of these funding models. And I think that's really what the ambivalence in this response is leading towards. Our third theme, similar to others, is around clinical pharmacy resourcing for inpatients aligned with evidence-based recommendations. I think we know nothing is more important in making a patient's healthcare journey safer from medication-related harm than the provision of evidence-based clinical pharmacy services, and that's a fact recognised in the national standards. Despite this, we've not yet realised evidence-based allocation of resources across the country. And I think the theme here, as you can see, shows significant ambivalence or uncertainty regarding the prospect that clinical resources will be allocated based on the SHPA standards of practice. And one of the recommendations we make at the end is that we move towards this, as is being done in some states. Next slide, please, Laura. Question 4 was around reimbursement for chemotherapy. And I'd say probably of all of the responses we received, this was the most concerning for the next 5 years. A very clear view coming across that funding for chemotherapy preparation will fall below the cost of safely dispensing and preparing it within 5 years. That view is expressed by 71% of respondents. And no doubt that pessimism is in part fueled by experience with the unilateral changes that have been made over the last 15 plus years to chemotherapy funding, as the governments have recognised the need to control the growth in high cost cancer treatments. The Australian government is currently reviewing the efficient funding of chemotherapy program. I think the outcomes of that review will be very keenly anticipated. And as we're seeing here, the outcome of that review will clearly be a key determinant of the viability of safe, equitable and affordable cancer treatment in Australia into the future. Our next question 5, related to patients who elect to self-fund their treatment, which is a highly contentious area. And I would guess that probably every pharmacist who's in the room today has probably been faced with a patient who's been declined funding, either by the pharmaceutical benefits scheme or by their public hospital, but who is willing to fund the cost of that treatment themselves. And those treatment costs can be in the hundreds of thousands of dollars. And often we're dealing in evidence-free zones with limited evidence for effectiveness, let alone cost effectiveness. So the ambiguity, split down the middle here in the responses is perhaps symbolic of the tension that exists in the principles that apply here. The principles of equity, that every patient should have access to health services based on their need and not their ability to pay, but also the principles of personal autonomy, that people should be free to spend their money as they choose on decisions that they feel may improve their life. I guess a parallel and related issue to this is that treatment within Australia with medications is currently subject to something of a postcode lottery, whereas some hospitals will fund treatments that others don't. And that's where patients end up in these circumstances. And that leads to our next question, question 6, which was around standardised access to medicines within each state. So we asked whether decisions around formulary listing would move to be being based on a statewide basis rather than local or regional within the next 5 years, clearly to reduce that postcode lottery, at least within state lines, if not across. And I think the significant positivity expressed here is really a call to arms now for all of us in health services or state health departments to capitalise on that optimism and drive the adoption of state-based formularies. Our final question, question 7, was on automated pharmacy technology being used to drive budget management. And it was also pleasing to see the huge optimism that respondents expressed that automated pharmacy technology will be used to drive budget management for pharmaceuticals. And we all have an ongoing challenge in understanding and controlling medication costs and, of course, reducing medication waste. And it's been clearly demonstrated that automated medication technologies can assist in achieving both of those goals. So I'll move to the next slide, please, Laura. We made just 4 recommendations. The first was that there should be complete national coverage of the pharmaceutical reform agreements, and those states and territories currently not subject to them should push towards adopting them as a matter of urgency. The second is that for all of us who are planning new models of care, that we consider how access to pharmaceutical funding will be affected by those models of care, and that we develop those models of care cognizant of the pharmaceutical funding agreements. The third recommendation we made was that all states and territories or all hospitals and care providers should adopt pharmacist to bed ratios based on the SHPA practice standards. Tasmania has already adopted those into policy, and I understand Victoria is currently considering the adoption of those in its enterprise bargaining agreement. So there's clearly a groundswell of support there growing that we think should sweep across the nation over the next 5 years. And finally, that those of us with the responsibility to do so work towards statewide formularies to ease the inequity in our health system. So I think overall within the funding theme, there was probably quite a high variability in the responses, which probably really reflects the highly uncertain funding environment in Australia right now. And we know we have challenges that we're facing on the horizon relating to chemotherapy funding, equity of pharmaceutical funding, and funding models for pharmaceuticals and for pharmacy services that align with the innovative clinical care models that are now being developed. So with that, I'd like now to pass on to Andrew McLaughlin for theme 6.
Thanks very much, Tom, and thank you for the chance to be involved in the forecast again this year. I'm coming to you from Gadigal land here in Sydney, and I'd like to actually pay my tribute to the real experts in workforce wellbeing who I was lucky enough to work with on this project. Paul Toner has already had a thanks, but also Sally Marotti and also Carly Johnson, who just provided really fantastic insight. Supporting workplace wellbeing has come into very sharp focus amidst the demands of the COVID pandemic. And the aim of this theme was to investigate over the next 5 years, what is the likely impact on workforce wellbeing on the hospital pharmacy sector. So if we look at the first question, it was really asking on the next slide. The first question was looking at around whether staff would feel they have a safe working environment where they can raise issues here. And it was heartening to see over the next 5 years, that's certainly the case. However, it did show that 12% of people, or remember, these are the forecast participants, were the leaders, felt their staff would not be in a position to actually raise questions or concerns about workplace stress. So there's still work to do there. Question 2 was probably the kicker for me. 1 in 5 pharmacy staff are expected to leave or change their roles based on the challenges of workplace stress and burnout. And you can see that that was a resounding majority. Now, this does align, unfortunately, with international studies in pharmacy and also in other healthcare professions, and probably exacerbated by the COVID pandemic or the response to it. Interestingly, a lot of the analysis, and when you read the report, you'll see our comments around the importance of workplace culture and how that has an implication on, whether or not people, have the resilience to maintain their roles under these circumstances. Question 3, it was really looking about recognising the need for structured support, and you could see that there was a resounding agreement that providing structured support and training around mental health and wellbeing in the workplace was a good investment. So in question 4 on the next slide, you can see the question about whether or not where the organisational priorities stood within for mental health and wellbeing of staff. And interestingly, this question was asking about within work health and safety, a very important framework that we use to determine resourcing and priority actions. While there was certainly a majority of responses that work health and safety plans will include staff wellbeing and mental health support, you can see it wasn't unanimous. And that, I think, is certainly an area for further opportunity and action. So questions 5 and 6 were really about pharmacy department response about the wellbeing of their staff, particularly amidst the many different initiatives and activities that happen within there. Some of the questions that came up and we think were related to some of these responses not being comprehensively in the positive were probably related to resourcing and the need for, or the need to consider competing demands. The last question was really about the role that data might play and timely access to data to guide priority setting for staff. And really that question about if we could improve the efficiency and effectiveness of staff and their ways of working, could we improve their overall support and wellbeing? And you could see that there was generally a positive response towards this. So if we swing to our recommendations, which are on the next slide, you can see that we made quite a number around the idea to recommend the prioritisation and action that are needed to support workplace wellbeing, and to see this as an investment in human capital and staff retention and effectiveness. So you can see that idea of normalising, of fostering a culture and advocating were very important, both on this slide and the next slide, please, which really emphasise the need for further prioritising workplace wellbeing within the structures we already have, such as WHS plans, and also that idea of providing the resources to support people to be effective, but also to work safely in a workplace that supports wellbeing. Thanks very much. I'll hand back to Tom. Just going to manage questions.
Thank you very much, Andrew. And thank you to the entire advisory committee team. So I'd like to now open the discussion to attendees. I can see some questions have bubbled up through the presentations, and just a reminder to pop them in the chat box. And I might just scroll back and start handing questions to our panel members. So we have one from Zayad Ibrahim about lobbying the PBS and covering precision oncology stroke cancer care model led by NGS rather than restricted to indication. Look, and I think that's one around the, I've chosen one that's around the theme that I was involved in, which was the pharmaceutical funding. And certainly, Paul, I'd also invite you if you'd like to offer a view as you're involved in this. But look, I think that's going to be an area, a key area for the for the next couple of years that I know the Australian government is considering opening up access to PBS funding for pharmaceuticals based on tumour type, or I know it's been lobbied based on tumour type. I don't think I have any visibility of where that's going. Happy if anyone else wants to leap in with an answer. And I will move. Let's see.
Got a question here for theme 6, workforce wellbeing. So do you think the workplace stresses that we see played out in the media have an impact on the ability to recruit pharmacists into hospital practice?
Thanks very much. I think clearly the challenges that are facing healthcare amidst the challenges of funding, but also the demands of the community, but also of the COVID pandemic, have certainly placed a really important pressure on the health system, but actually the people who work in it, which I think has been the most challenging aspect. I can speak from the university's point of view. Where I work, we've actually seen an increase in all of the health disciplines, particularly pharmacy, when it comes to enrolments. And that's meant that the wider community has certainly recognised the need for and the role of healthcare professionals. So there's been increased demand there. What it actually means on the ground for people, if I think about early career pharmacists making a choice about an area they'd like to work in, I should imagine the media attention would put a significant amount of pressure on their decision making. And that probably reflects across the sector, but I don't think we can disentangle that media pressure. Maybe just while I've got the microphone too, great comment there from Kay Dunkley, and g'day Kay, and your great support for pharmacy support services, about the importance of resourcing and supporting the individual, but also having an impact on the environment, the culture of the organisation. This was certainly a theme that came up in our conversation, and when you get a chance to read the Pharmacy Forecast Australia document, you'll see some of our contextual thoughts around that. But we'd certainly wholeheartedly agree that we included recommendations about building a culture within the organisation that creates and supports staff wellbeing. So thank you for that question.
We have a question for Ange on deprescribing. Sorry, I just lost it on the screen, but it was about the. Sorry, I'm not.
I've got it here.
Down. Thank you. Excellent. Thanks, Laura.
Yeah. Okay. Do you think perhaps the response may reflect that perhaps there is a feel that all clinical pharmacists should have the skills and drive to deprescribe medicines appropriately for their patients, particularly those who work in aged care?
Thanks for the question, Sally. And I think there was also an earlier question from Debbie around are there any existing models of deprescribing stewardship, and how do you envisage communication and collaboration with primary care providers such as GPs in aged care? So really relevant questions. Thank you both, Debbie and Sally, for bringing those to the forefront. I think, so Sally's question first around, should this be a skill of all pharmacists, particularly working in aged care? Let's go back to the conversations that were had around antimicrobial stewardship and analgesia stewardship. I think there are going to be people that sit on both sides of the fence, absolutely. I think the authors in this theme were just really keen to bring deprescribing to the forefront and have a conversation. It doesn't necessarily mean that a stewardship pharmacist is the answer. I think it's about every service having a look at what's most appropriate and suitable to their service, to their patients and to their community, and then working with a model that will best fit them. Debbie's question around are there existing models of deprescribing stewardship? We weren't able to find any publications, particularly around this area, so it could be fairly novel. And how do we envisage communication and collaboration with primary care providers such as GP and aged care? We've had a comment already saying that this should be starting at the hospital, but definitely it needs to broaden beyond the hospital. It needs to be happening in community as well, aged care facilities. if pharmacists are able to embed themselves with those teams, the benefits, the real benefits can be realised, I think, across the board for those patient journeys.
Thanks, Ange. Question to Russell for theme 2. Is it likely that the move to produce workforce-ready pharmacy graduates, coupled with the 80% of students having an interest in hospital pharmacy, likely to drive an early differentiation of the workforce, hospital versus community pharmacist graduates?
Thanks for the question. Andrew's probably more better placed to answer some aspects of this one than I, but I think it's a bit about awareness too, really, amongst our undergraduates until they've had some exposure to hospital pharmacy earlier on. My understanding is they don't always know much about hospital pharmacies. They haven't thought about it, but it's good to see, I think, that now, 82% of undergraduates are interested in hospital pharmacy. So whether that leads to a differentiation in the curriculum, I don't know that that's particularly necessary. It's more about the experience, and the gist of this question would be hoping to see, maybe we can do away with the traditional internship year if it's somehow incorporated into an undergraduate course, so that we can put people straight into hospital positions at an entry level, of course, maybe something like that, rather than relying on our limited capability to recruit interns that first year after they finish their undergraduate studies, and then having to get people back into the sector through other routes down the track, which can delay careers, I suppose. But I'll be interested to see what Andrew thinks about some of those. If I can ask you to speak on that one, Andrew.
Sure, Russell. And look, thank you for the opportunity to comment. Of course, all pharmacy programs across Australia need to be accredited with the Australian Pharmacy Council. So the manner in which they train pharmacists is not stipulated down to the exact detail, but obviously there are performance outcomes that every program must deliver for their graduates. And right now, that means that every graduate has the potential to work in any area of pharmacy practice, whether that's community, hospital, and the many other roles that pharmacists have, certainly at entry level. So that's how most of the programs are designed. Importantly, though, we know from surveys of the students led by NAPSA and other organisations, there is a strong interest in hospital pharmacy. And I know from my own students that I have the privilege to teach that they're very, very interested to work in hospital. So I think your comment is a very important one, that most students don't want to necessarily decide what area of pharmacy they will work in for the rest of their career. The current young people are going to have many careers, which is really quite interesting. But we do need to make sure they understand the career pathway in different areas that their pharmacy degree can take them. And I'd agree with some of the responses that we need to perhaps improve the understanding of our students of what it's like to work in hospital practice and what are the career trajectories that will take you in there. And that better understanding early on in their career, I think, will create very realistic expectations and hopefully drive demand, which I think is important. I'd also say that right now as well, groups like the Pharmacy Guild are also mounting campaigns to increase the awareness of community pharmacy. So there's strong demand for student places, but it's important that we all have the professional responsibility to educate and mentor. And that came out very recently with the AHPRA Code of Conduct Principles, which came out just last week, highlighting that all practitioners have a role in training and developing and mentoring the next generation of practitioners. So that's great.
Thanks, Andrew. We have a question from Melanie. How have the leaders addressed workforce attrition rates? There's a focus on upskilling the new workforce. How are leaders enhancing senior positions in their departments for those who are already skilled? If budgets are primarily capped and FTE is what is then adjusted, how do departments fund a more highly skilled workforce? Look, as a director of pharmacy myself, and I'll open it to anyone on the panel to respond if it feels appropriate, I can say, I think this is one of the biggest challenges that we currently face. How to, I guess, as we approach, hopefully, the post-pandemic era, how do we ensure that the loss of morale that's happened through the pandemic, and that perhaps the detachment from the workplace that's taken place, and the impact that's had on training of staff, where you haven't been able to bring people together in the same place, in the same room, to provide training on things like workforce culture. How do we move forward with those challenges? And I'd certainly say myself, I don't feel this is an area to which I have the answer right now. It's very much a topic of current relevance. But I probably would say there's never been probably more willingness from our health funders to invest right now than there has been over the last 20 years in supporting the health workforce. That's my personal view. Anyone on the panel feels they'd like to answer, go for it. Fair enough. We have a comment on the previous discussion around training pharmacists as hospital pharmacists or community pharmacists from Sasha Bennett, observing that it is best to be trained to work in both community and hospital settings, as we need flexibility and it provides appreciation of the challenges of the settings and informs one's practice. Let's see. The importance, so from Jane Donnelly, the importance of sustainability is pervasive across all themes. Was there consideration given to sustainability as an individual theme instead of only focusing on environmental sustainability, considering the links across workforce, environment, technology, funding model, environment, economic and social dimensions of sustainability? And I'll probably look to Russell as the chair of our group to give an answer. But I think it's certainly valid, at a time when our resources have never been more used up in any capacity, whether it's workforce, whether it's well-being and morale, whether it's the resources and the single-use plastics that we've all used through the COVID pandemic. Sustainability has absolutely been front of mind for all of our themes. Russell.
I think it was a bit more focused on environmental sustainability. That was what came out through the working parties as a theme that would be worth exploring further. But you're right, Jane, that obviously sustainability relates to a lot of different themes that we've discussed. And I think you'll find elements of that picked up on a number of the different discussions in the actual document, particularly under Andrew's theme of well-being as well. That's about sustainability, isn't it? That's about keeping our staff in, and also sustainability about, in my theme, future workforce, where it comes to recognising the specialisation, the need to continue progressing work in that area, and also promoting the fantastic things that we can do outside the normal scope of pharmacy practice that most people expect us to be doing. Those things speak to sustainability, and to some degree, I think, in all different ways for the workforce as well as the environmental aspects. It's a bit of a general answer.
Thanks, Russell. And we've had a comment from Sonia Stacey saying, enhancing senior and skilled workforce, we can offer opportunities to stretch and develop in new areas through trainings, comments, and mentoring, maintaining broad skills and interests, recognition and acknowledgement. And SHPA obviously can play a key part of all of this: mentoring, training, advancing practice, credentialing, etc., which is very much true. A question from Sasha again: should SHPA be advocating for a national hospital formulary to reduce duplicate activity in all the jurisdictions? I guess I was on the theme that discussed that. I certainly couldn't disagree that it makes no sense, from starting from that fundamental principle of fairness, that you can cross a state boundary and lose access to a medication that you were previously accessing, and vice versa. And I know, as I sit on our formulary committee, I've been challenged by those situations as well, when we have someone who moves to the state, expecting quite reasonably to retain access to medicine. And I don't know about other states, ours is generally operated on a reciprocal basis, but I don't think that is common nationally. So look, I certainly think that is a direction in which we should move. And there's, I guess, questions more broadly around where the PBS and public hospitals should go. Right from the beginning, there were discussions around a national formulary being linked to reform agreements, although where that's going to be above my pay grade to think about that. I think we can wrap up questions there with a wonderfully paced question from Brenda Shum, which I will then hand to Kristen and Peter. So the final question is, are there considerations of how SHPA can assist hospital departments to implement the recommendations in this and the previous forecast? For example, embedding these within both strategic and operational planning, specialty practice group leadership committees to develop tools, principles that can assist with advocacy and implementation. So with that question fresh in your mind, I'll hand over. Just a note to everyone else present. If you have any other questions, we'll all be happy to answer them directly. Feel free to email Laura Opray, which is lopray@shpa.org.au. So now I'll hand over and finally introduce SHPA Chief Executive Kristen Michaels to conclude the session.
Thank you, Tom. Thank you so much. And look, thank you to all of our committee members for such an excellent deep dive into this year's forecast. There's been such an incredible buzz around the 2022 report, and I think that's been reflected in the conversation and all of the questions that have popped up in the chat just now. I've been getting emails pretty much every day about this launch, so it's hard to believe we're only in our second year. It's been a huge undertaking, and of course, I just want to sincerely thank our 9 superstars on the advisory committee and this year's 11 theme leads. All too often, reports like this can just sit on the shelf, but really what you've created here is a timely, relevant and actionable report. And really at SHPA, we're looking forward to making it a centrepiece of our broader activity as we work with all of our members to advance the profession. And I also really want to thank our like-minded organisations who provided this year's partner perspectives to help contextualise the themes. You'll be able to read those once you're able to dip into the full report. So I'd like to thank the AMA, the Australian Medical Association, the Climate and Health Alliance, the Australian Digital Health Agency, the National Australian Pharmacy Students Association, NAPSA, and the Pharmacist Support Service. And of course, I really want to once again thank Omnicell for their support of the forecast. Thank you, David, for your presentation earlier today, and to everybody else from the team who was present to support today's presentation. I think it's really interesting and quite wonderful to see the forecast reflect such a forthright tone this year. Of course, following 2 years of the pandemic, the lockdowns, the resulting stress, fatigue and burnout, that tone, I guess, does reflect so much of that, but perhaps it's unsurprising that you've been so forthright in what has come out. Hospital pharmacists are already Australia's captains of medicine. You manage almost 1/4 or $3 billion of the annual PBS budget. And research continues to build that shows hospital pharmacist-led medication management services can reduce hospital readmission rates and medication-related hospital admissions. So as we look to the future, equipped with the lessons of the recent past, SHPA will utilise the crowdsourced wisdom of our independent forecast authors to continue advocating for a more sustainable expert workforce, that is present wherever there's medication risk. As we've heard already from Tom, there were many, many cooks in the forecast kitchen, but I do particularly want to shout out to the members of the SHPA team who worked tirelessly on the forecast. I particularly want to thank Laura and Nick, who put together so much work on this, but also to Rob, to Jerry, and to Jules, who is the genius behind today's Zoom meeting, but all the people who made the forecast possible. And now I'll pass over to Peter for his closing thoughts. Thank you, Peter.
Thank you, Kristen. And thank you, Tom, Russell, and all presenters today for a truly fitting launch to our second Pharmacy Forecast Australia. In reading through the 2020 report, I am struck by some new and emerging themes, and notably mental health and wellbeing, models of funding and environmental sustainability rose to the surface as Australia continues to adjust following the most challenging period of the ongoing COVID-19 pandemic. And I think it's important today to reflect on what this means. A report like this is a snapshot in time, a chance to reflect on who we are as a profession and who we want to be. The wisdom of crowds is telling us that we should look after ourselves as we look after our patients and work to protect the planet as we drive innovation. These principles sit alongside our evergreen focus of ensuring every Australian has safe and equal access to quality pharmacy care. And I would not argue with this. And I hope that as the second half of 2022 unfolds, all hospital pharmacists and technicians on the call today and our hospital, community pharmacy and healthcare peers find ample time to relax and reflect. I look forward to hearing the conversations driven by Pharmacy Forecast 2022 and seeing what rises to the surface as we look towards Pharmacy Forecast 2023. So until next year, thank you very much for attending and please enjoy your afternoon.